and welcome to the Healthbeat Show. I'm Dr. Jeffrey Watson, and we have a great one for you here today. Today we're going to be talking with one of the top specialists in the area of rheumatology, and that is in none other than Dr. Michael Newelt. Welcome to the Healthbeat Show.
Thank you, Jeffrey. Good to see you.
It's such an honor to see you again. It's been a little while.
Yeah, absolutely.
Since we've seen each other. But you are one of the top rheumatologists in the Bay Area. And you are an academic physician.
Yes.
And also a practicing physician.
Absolutely.
In the area of rheumatology. Now tell us a little bit about your background, your training, and what is a rheumatologist?
All right, very fair question. You know, I went to medical school in George Washington University in Washington, D.C.
Mm-hmm.
And then I
Top school?
Pardon?
Top school?
No, I don't know if it's top
expensive
school.
Too.
It's a good school. It's expensive, but it's a very good practical school.
Uh-huh.
And then I decided to do internship and fellowship in rheumatology because I was sort of fascinated by the diseases, and I kind of like mysteries and putting puzzles together. And beyond sort of typical rheumatology, which is musculoskeletal disease and arthritis and rheumatoid arthritis, I became fascinated with the disease lupus because I like the way you took different signs and symptoms from different organ systems and tried to make a diagnosis, realizing it's a very challenging diagnosis, but it was fascinating to me. So in 1979, I came out here to the East Bay, and it appears like it was almost a perfect storm because I got a job here with a clinic, which I left fairly quickly because I knew I wanted to be on my own. But in the East Bay, we have sort of a, as we well know, a multi-ethnic population, mm-hmm. and about 30% of the people are, you know, people of color, and especially women who get lupus. So I began developing a fairly large population of lupus patients, which I found fascinating. If somebody said lupus, bring him in the door. I wanted to see him because I was fascinated by it. And that went on for a long time. And then over the last 15 years, we've had new drugs that we're working on to try to treat lupus beyond the drugs that we've used in the past, which are from other specialties, whether it's from oncologists or infectious disease, etc. And then we've come, although we've had some negative trials because of the idea lupus is such a multifaceted disease that it's sometimes very hard to get the right endpoint to measure improvement or to make sure you're treating the right subset of patients. And while I did that, I also did the normal forms of rheumatology, see lots of people with rheumatoid arthritis, where lots of new drugs have been developed.
And when we talk about things like lupus and rheumatoid arthritis, we talked a few minutes before we went on, and you indicated to me that that's an autoimmune disorder.
Yes.
And that is, what does that mean? What's
Okay.
autoimmune mean?
Well, it means that your body's immune system, which is developed to protect us, turns and makes antibodies against self. Mm-hmm. And that's, you know, and I think the two most prototypical autoimmune diseases are rheumatoid arthritis, that, you know, predominantly causes arthritis. It can have more systemic manifestations. And then there's a disease called systemic lupus erythematosus, or lupus, mm-hmm. that affects sort of a different population. It's more common in women. It's 4 to 6 times more common in African Americans. And they can get arthritis, but they can also get many other things, mm-hmm. such as photosensitive skin rashes and lung problems, kidney problems, brain problems, lung problems.
And that's why they call it systemic. It can involve
exactly.
the whole system.
Yes.
So an autoimmune disorder. And how do you diagnose an autoimmune disorder? I mean, do you just look at somebody's skin to see if they have a rash or their joints? Are there certain blood tests?
Yeah.
Are there certain x-rays? Are there certain factors? Because as both of us have been practicing for a little while now, it's not easy to diagnose some of these problems because they don't always have a typical positive blood test.
Some of the other autoimmune diseases aren't as easy. And you have to take a pretty extensive history and exam to see if you think they meet criteria. And I guess I'm always going to come back to lupus because that's my love and that's what I care about.
That's the area that you're a specialist in. We're speaking with Dr. Michael Newelt. He trained on the East Coast, Washington, D.C. He is a rheumatologist. Rheumatologist deals with this process that we call autoimmune disorders, where your immune system works against you. Stay tuned because we're going to be right back. We're going to be talking more about lupus, something that is kind of difficult to diagnose sometimes. You're one of the top specialists. Stay tuned right here on the Healthbeat Show.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
Hi. You think you're probably sober?
Yeah.
But you're thinking about taking the back roads home, just in case. Why would you do that?
Probably okay isn't okay. Call a cab, a car, or a friend.
Good choice.
And welcome back to the Healthbeat Show. I'm Dr. Jeffrey Watson. I'm here with one of the top rheumatologists, I understand, in the nation, in the whole United States, maybe even in the world.
When you deal with lupus.
When you deal with lupus and the specialty of lupus, we're talking about systemic lupus erythematosus, an autoimmune disorder in which you have a great specialty. Now, you also do research.
Yes.
You do clinical trials. And, there are some people that are a little nervous about that. But we found that these are very necessary so that we can find the cures.
Exactly.
And we try to make sure that they're safe. Things are very sophisticated nowadays compared to how maybe they used to be. Tell us a little bit about the research that you do, because, you're an actual clinical practitioner. I send you patients.
Yes.
But then you do research to try to help people understand what are the best treatments for systemic lupus erythematosus.
It's a good question. Mm-hmm. Well, in my office, we have the East Bay Rheumatology Research Institute. And we started this because, as I said in the prior segment, we have lots of patients that have lupus. And up until about 2011, there hadn't been a new drug for lupus in 50 years.
Wow.
And then one drug met the bar to get through, a drug called belimumab or Benlysta, which depletes a inflammatory protein that's upregulated in lupus called BLyS. And that trial got through, although the original trial was negative. And then when they looked at people that had just a positive ANA, it met its endpoint.
And the ANA is the blood test.
Yeah, anti-nuclear antibody, yes.
That's 98% of the time positive at some point. It may not be positive when you first test somebody or second or third time, but at some point when you put together, like you said, the physical exam, the joint findings, and the other things, it should turn up positive, I guess. Yeah. But you're saying that this medication, what's the name of the medication again?
The generic is belimumab, and the brand name is Benlysta.
Benlysta. Is it actually out on the market?
Oh, yes, it's out in the market. And one of the things about the drug is, in order to get it authorized through insurance, people have to have a positive ANA recently, so that becomes a problem. And the reason they did that was, in order to get the study finally to look positive, they only studied the patients that had a positive ANA. Now, research medicine is very different than real world medicine, because the ANA, once it's positive, we usually don't repeat it. Mm-hmm. But what happened was, when they found that they only looked at the patients that had a positive ANA, those patients were right down the middle and tend to have more of these autoimmune antibodies. Mm-hmm. So at second look, it became positive. And since there's been such a lack of advances in drugs for lupus, it was able to be approved by the FDA. Now, there's a lot of other drugs that we've tried.
And it's interesting. I've been in practice over 30 years. I've never heard of it.
Yeah.
And I guess you may have to be in a special area. And I treat a fair amount of lupus, so that's very interesting. I'm learning something.
Well, I want you to learn.
Yeah, that's why
You've
we're
taught
here.
me a lot through the years. So now we're trying different things. And to me, one of the most exciting studies we're doing, and we're involved in this, and it's a worldwide study, is taking a drug that we looked at in lupus called rituximab, which is a B-cell depleter, which you probably have heard of because it's used in lymphoma. And we did a study of that, and it was a double-blind worldwide study. I was the second author. The study was negative, but probably it was negative because we overtreated the placebo group because we didn't want them to flare. But doctors anywhere kept using it in what we call just observational series, and it's become pretty well accepted as a drug that we use in lupus.
But it does work, is what you're saying.
Oh, absolutely. You know, it does work. And we're going to take that drug and use it with the drug that's been approved called Benlysta. And what the rituximab does, it depletes the B cells. So Benlysta will be given, it gets the B cells out of the tissues, they go up, these bliss levels go up, and then we give them the rituximab. So it's a sort of a bang bang. And this study is a little bit different because we're going to try to get patients off their baseline medications and sort of look for, I don't think cure is a good word, but major control where they can get off their regular medications.
And so some of the people are on steroids and things like that's been for those of us who don't know all of these sophisticated medications, you know, Plaquenil, steroids, maybe some on
Stop. You said it. Most patients with lupus are on low-dose prednisone, perhaps, and hydroxychloroquine or Plaquenil, which are important. But what we're trying to do, because steroids over a dose of about 6 milligrams can have a long-term side effects, including cardiovascular complications. So we're trying to get, you're just right on, Jeffrey. We're trying to get people off these steroids.
Right, because they can cause diabetes, weight gain, the bones get soft, all types of things. We are talking here with Dr. Michael Newelt. He is one of the nation's top rheumatologists, a research physician. I want to know how are we going to get people into the trials because we want to see people get cured.
Yes.
And so I want you to stay tuned. We're going to be right back with Dr. Michael Newelt, and we're going to have a patient that has lupus that you can interview. They can tell us about what their pathway has been like. Stay tuned. I'm Dr. Jeffrey Watson. We'll be right back. I'm Dr. Jeffrey Watson. If you want to ask us some questions or you have a topic that you'd like us to explore, go to healthbeattv.info. I'll be glad to work with you in any way that we can, because I always believe that if you knew better, you could do better.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
The AAWP Medical Minute is sponsored by the African American Wellness Project.
Hypertension is much more common in African Americans. But is table salt to blame? I don't know exactly what to tell you. Some experts suggest that too much salt is a problem. Others are worried about too little salt. For most of us, a little more than a half a teaspoon of salt a day is sufficient. But for people over 50, those with hypertension, and African Americans, much lower amounts are recommended. But there's no conclusive evidence for these amounts. And too little salt can be a problem for people with heart disease. I believe you should control your salt. But remember, most of the salt does not come from the salt shaker. So if you need to cut down, read labels. As for my specific advice on how much salt is too much, it may not be scientific, but my grandmother had an answer: a little bit more than a pinch. I'm Dr. Mike Lenore with the African American Wellness Project. This message is sponsored by the Dan Weinstein Family Fund.
If you have a business, product, or service and would like to advertise on Healthbeat, contact us. We feature affordable advertising for small, growing, and established businesses. Reach an accessible audience to over 4 million viewers. Promote the health and wealth of your business and give us a shot.
For advertising and sponsorship opportunities, log on to healthbeattv.info.
Hi there. And I'm Dr. C. Michael Newelt. I'm a rheumatologist in the East Bay, and I've been in practice for, it's hard for me to believe, 39 years. And I'm fortunate enough to have been taking care of Cheryl Ward as one of our patients with lupus, who is a disease that we were talking about that is 4 to 6 times more common in women of color. And I know that Cheryl's gone through quite a path of trying to get the correct diagnosis. Isn't that correct?
It's very true.
Yeah. So why don't you tell me, Cheryl, when you first started having problems?
I think it was about 1991. And I was wearing long hair. I would comb my hair in the mornings, and just clumps of hair would come out.
Yes.
And didn't pay too much attention to it. Then I started being really tired. And I didn't pay too much attention to that, you know.
And were you tired even if you got a good night's sleep?
Even if I got a good night's sleep.
And would you ever have to nap in the afternoon?
I was working, so an afternoon nap was out of the question.
But would you get tired in the afternoon?
I would be exhausted.
And how old were you then?
I was probably about 26, 27.
Yeah, so that's a young age to get tired in the afternoon. Okay,
Yes.
Go ahead.
In the evenings, I'd come in from work, and I was achy, and I would take a hot bath, and I'd be in the bed by 6:30, 7 o'clock every evening. And then on the weekends, on Saturdays, I would stay in the bed till 2, 3 o'clock in the afternoon. And a family member said, that's not normal.
Absolutely. You know, I think that's why age is very important. You know, some people, as we get older, we don't sleep as well. But for someone your age, and you know, one of the signs of systemic fatigue, which it really sounds like you had, is you probably had a little more energy in the morning after sleeping, and then you run out in the afternoon and be really tired. And then, as you said, you had to sleep on the weekends. Now, did you have describe your joint pain? What joints bothered you the most?
So it started in one finger. Just one day, one finger started aching right in this joint.
Right in the joint,
finger,
yeah.
Right in the joint.
Did it swell? Was it warm and hot?
Nope, it just ached.
Okay.
And then shortly after, several other fingers, same thing.
Right. And you're still around 26?
Still around 26.
Yeah. Again, very unusual for somebody 26. Hair falls out. She has what we call systemic fatigue. She starts getting pain and swelling in her joints. Any other problems you had at age 26?
My legs, I was working out regularly, and my legs would get this heavy sensation. And so it made it difficult for me to work out.
I see. So did you have to stop working
I had
out?
to stop working out.
And any other problems? You had any sores in your mouth or chest pain when you took a deep breath?
Sores in the mouth.
Okay.
And the inside of my hands just started peeling. The skin in the hands just started peeling. And it made it difficult to close my hands like this, or especially to even turn a doorknob.
Okay. And was that worse in the morning when you'd wake up and get better, or was it all day long?
It was worse in the morning, and but it did go on throughout the day. But it was worse when you first get up in the morning.
And then when you use it and you loose it up, that gelling goes away.
Right.
All right. So you had quite a few things, especially for somebody at your age. Now, when were you first sent to, or when did you first go to a physician for this?
26, went to a physician, and initially I saw a nurse practitioner, and she said it sounds like arthritis. And they ran some tests, and it did not show up in the test.
Okay.
But from what she saw, she said it was definitely arthritis.
Okay.
And I rejected that. I was 26. What do you mean I have arthritis? I don't have arthritis, And then when she put all of those symptoms together, she said, I think I'm going to send you to a rheumatologist. Well, I had never even heard of a rheumatologist.
Yeah, exactly.
And so...
That's why in the earlier segment we were sort of trying to define what a rheumatologist does. And
right.
A lot of people don't know what a rheumatologist does.
Right, you've never heard of it. One of the things that I am doing now is really trying to help other women, particularly African American women, that have been diagnosed, and even those who are trying to be diagnosed. And so I started a program here in Oakland called Lupus Oakland East Bay. And so we are committed to the dissemination of education and awareness in communities of color, and particularly African American. So we are launching our program actually on the 21st of this month at 12 noon at Yoshi's, and we're having a luncheon, and you are one of our awardees.
Well, thank you. I'm going to be happy.
honorees.
My wife is going to come too.
Okay.
And I think our grandson,
All
because
right.
she's babysitting.
Okay. And so this is good because one of our focuses coming up will also be pediatrics and children that have lupus. So
Yeah.
we'll be talking more about that. So Lupus Oakland East Bay, luncheon April 21st, 12 noon, and I hope that we can get good attendance and you'll get a chance to meet this wonderful doctor and our other awardees.
The Healthbeat Show, sponsored by Watson Wellness Water. Your health is your wealth.
The AAWP Medical Minute is sponsored by the African American Wellness Project.
Our series on improving brain function and reducing the risk of Alzheimer's continues. I'm Dr. Mike Lenore with the AWP Medical Minute. 3 areas for optimism in controlling Alzheimer's include diet, medication, and exercise to reduce hypertension. Today we focus on diet. Claims about diets for brain health are plentiful, and recently researchers found that extra virgin olive oil helps stave off Alzheimer's, at least in mice. Those fed a diet enriched in extra virgin olive oil could learn and remember better than those not fed the diet. And while the panel did not find evidence to recommend any specific diet, those diets that included whole grains, fruits, vegetables, low-fat dairy, and keeping salt down deserve more study. Our next segment will focus on medications available. AWP Medical Minute is supported by the Dan Weinstein Family Fund.
I'm Dr. Jeffrey Watson. We're right here with Dr. Michael Newell. He is a rheumatologist. That's a specialist in problems like rheumatoid arthritis, but your particular interest is in systemic lupus erythematosus. You said something very interesting at the beginning. We live in a multi-ethnic society in the Bay Area here, but lupus involves people of color quite frequently, African Americans, and more African American women probably than any others. It's kind of an elusive disorder for those of us who haven't had the type of experience that you have had. And so some of the doctors miss it. You said that you have to have a blood test called an anti-nuclear antibody,
Yes.
or an ANA. And you are doing some research on medications that I've never really been close to giving anyone. I didn't even know the name.
You don't know everything.
Yeah, I don't know. My wife tells me that too.
Well, my wife tells me that too.
But anyway, I want to see people, of course, I'm very interested in healing. I want to see people get healed. The process of research now is very sophisticated, as we've heard from you. It's a very safe process because you've had systems set up to make sure that it is safe.
Yes.
But how would we get people into these trials if they were interested? Would their doctor have to send them, or could they call you directly and say, listen, I think I have lupus, my doctor hasn't tried anything new, all I'm taking is the Plaquenil and prednisone that we've talked about. I want to get this under control. How would we get into a research trial?
Well, I think for, our research center, basically one would take their records and we could review them. And, the number of our research unit is 510-357-1040. And you would talk to one of our research assistants. And I think the best way to start would be we could review the records. Mm-hmm. Because as I've alluded to several times, in order to get into a trial, you have to have a positive anti-nuclear antibody, or ANA. And then we would look and see that if your disease is active enough, and we have these measurements of activity, because you don't want to try a drug on somebody who is told they have lupus, but they're not active. So they have to have activity. And then if we think that this patient has activity, we would perhaps call them and say, hey, why don't you come in and we'll see if you can fit into this trial or other trials that we do. And or perhaps, what they want to do is come in as a private patient and be seen for, further investigation, because
So they have to meet certain criteria, so to speak,
absolutely,
for the particular trial. But also, you being a practicing rheumatologist, you've seen several of my patients and actually have treated my family, I would say, and you're the first person that I really went to knowing that you're the best in this area.
He's really trying to butter me up.
Not really. We're speaking with Dr. Michael Newelt. He is one of the nation's top rheumatologists. He has been doing academic work along with clinical trials, along with practicing. So we want to tell you, what's the number that we would call if we wanted to get in touch with you?
510-357-1040. And, the name is the East Bay Rheumatology Research Institute.
All right. There's so many things that we want to talk about. We want to talk to you some more. And we've also got some big programs coming up in which we're going to educate people in the community about lupus.
Great.
At Yoshi's, we'll talk a little bit more about that. And so that'll be a wonderful thing. Remember always that your health is your wealth, and when you have your health, you have everything. We've been here with Dr. Michael Newelt, top rheumatologist in the United States. Thank you so much for being here.
Thanks, Jeff.
All right.
It's my pleasure.
All right. God bless. I'm Dr. Jeffrey Watson. Thanks for being with us on this episode of the Healthbeat Show, where we try to educate you about different aspects of healthcare, about eating right, exercising right, what you can do to help yourself, how to access the healthcare system, what kind of questions to ask, what you should do for any particular disease state. Because I always believe that your health is your wealth, and when you have your health, you have everything. I'm Dr. Jeffrey Watson. We'll see you next time.
If you have your health, you have everything.